Good afternoon, everyone. Welcome to our online class. We are now going to discuss the last topic, which is political globalization, with the focus topic COVID 19, the roles of World Health Organization, and the Philippine government. Our discussion with the topic COVID 19, the roles of WHO and the Philippine government focuses on elaborating the meaning of political globalization, COVID 19 pandemic, the roles of WHO and the Philippine government, and the conclusion. My group mates Mohammed Alanka, Erin Calio, and yours truly, Jerome Alvarez, will be giving you another learning experience. Let's get started. Mohammed Alanka will discuss first the expanding discussion about political globalization.
Globalization is the process by which businesses or other organization develops international influence or start operating in international scale. It is also defined as an interaction that helps to solve global crises and addresses international problems. There are three main dimensions of globalization. 1. Economic globalization. 2. Social globalization. And 3. Political globalization. Economic globalization is the development of trade system within transnational actors such as corporations or NGOs. Social globalization refers to the process in which people's lifestyles spread over global networks such as media and other communication technologies. And lastly is the third dimensions, which is the main topic of this report, the globalization in politics. Political globalization is the evolution of political system worldwide. It refers to the amount of political cooperation that exists between different countries. It is a borderless political system that includes government of the countries around the globe. One of the aspects of political globalization is the establishment of global organizations or the IGOs, such as the World Trade Organization and United Nations, and also the emergence of international non-governmental organizations or INGOs, such as the Red Cross International Committee. Political globalization according to experts. According to William R. Thompson, political globalization is the expansion of global political system and its institutions in which interregional transactions, including but not limited to trade, are managed. For Manfred B. Steger, political globalization refers to the intensification and the expansion of political interrelations across the globe. Now let's move on to the political governance of the world, the nation state. The nation state has two basic components, nation and state. Nation, according to Cerny, refers to a social group that is linked through common descent, culture, language, or territorial contiguity. Also important in this context is national identity. It is a fluid and dynamic form of collective identity where members of the community believe that they are different from other groups. States, on the other hand, is the new institutional form in the wake of the demise of the feudal system. Cerny also said that the state offered a more centralized form of control and evolved an organizational structure in relatively autonomous office holders outside other socio-economic hierarchies with its own rules and resources, increasingly coming from taxes rather than from feudal or personal or religious obligations. The nation state can therefore be seen as an integration of the subgroups that define themselves as a nation with the organizational structure that constitutes the state. Moving on to the effects of the political globalization. For the advantages and positive effects. Number one is the increase of gross domestic products or GDP. Statistics shows that in GDP in developing countries has increased twice as much as before, or opening of jobs for other countries OFWs for example results to high reduction of employment. Number 2, the corporation have greater flexibility to operate across borders. Global mass media ties the world together. Number 3, there is a unity of countries in terms of addressing global issues, such as the current COVID-19 pandemic. And number 4 is the launching of international human rights with the international criminal courts and international justice movements as an addition. For the disadvantages and negative effects, number 1, global inequalities or uneven distribution of wealth. There's an income gap between developed and developing countries where the wealth of developed countries continue to grow twice as much as the developing world. Number 2 is the terrorism or war. It is the most obvious global foe threatening the nation states involved, especially those on the losing side. And number 3, the inability of the nation states to control economic flows and crises or environmental problems are very likely to be destabilizing politically.
And now we are on our second discussion about the origin of the COVID-19 pandemic and how it impacted the lives of many across the globe. Hashtag origin of COVID-19 pandemic. The COVID-19 pandemic is among the deadliest infectious diseases to have emerged in recent history. As with all past pandemics, the specific mechanism of its emergence in humans remains unknown. Nevertheless, a large body of virologic, epidemiologic, veterinary, and ecologic data establishes that the new virus, SARS-CoV-2, evolved directly or indirectly from a B coronavirus in the Sarbecovirus, SARS-like virus group that naturally infect bats and pangolins in Asia and Southeast Asia. The World Health Organization, otherwise known as WHO, has released its plan to investigate the origins of the COVID-19 pandemic. The search will start in Wuhan, the Chinese city where the new coronavirus SARS-CoV-2 was first identified, and expand across China and beyond. Tracing the virus's path is important for preventing future viral spillovers, but scientists say the WHO team faces a daunting task. Most researchers think the virus originated in bats, but how it jumped to people is unknown. Other coronaviruses have passed from an intermediate animal host. For example, the virus that caused an outbreak of severe acute respiratory syndrome, or SARS, in 2002 to 2004 probably came to people from raccoon dogs or civets. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. Most common symptoms include fever, dry cough, and tiredness. Less common symptoms includes aches and pains, sore throat, We are 11 months into the COVID 19 pandemic, and infections and deaths are accelerating in many parts of the world. There are now more than 33.7 million confirmed cases and over 1 million deaths. The Asia Pacific region has comparatively low COVID 19 figures today, partly because countries have built up the capacities and mechanisms for emergency response over the years, guided by the Asia Pacific Strategy for Emerging Diseases and Public Health Emergencies, or APSED. As the pandemic in the Asia Pacific region is entering a new phase of the outbreak, governments and individuals need to take further actions to mitigate risk and minimize transmissions while maintaining social and economic activities. Some countries are starting to explore more sustainable and targeted response models that proactively work to suppress new COVID 19 outbreaks while reviving their economies and societies. Governments should further strengthen efforts to prevent the virus from spreading into vulnerable communities by identifying vulnerable populations, implementing infection prevention and control measures, and strengthening surveillance among these populations. Recognizing that the virus would be with us for a long time, governments should also use this opportunity to invest in health systems which can benefit all populations beyond COVID 19, as well as prepare for future public health emergencies. These investments may include: number one, capitalizing on COVID 19 enhancements through surveillance, lab, risk communications, and other core capacities. Number two, backcasting to identify gaps and steer resources to future health needs like genetic sequencing and contact tracing with information technology. And last, building on COVID 19 innovations to accelerate recovery and address other pressing health problems. The COVID 19 pandemic has changed life as we know it. As the rate of infections begin to slow down in some hard hit areas, early signs of recovery are appearing. Some towns, cities, and states are starting to slowly reopen businesses, public areas, and more. Until a safe, effective coronavirus vaccine is available, there will continue to be a risk of infection even as people get back to work, school, and more normal life. The protective practices you learned and followed in March and April of 2020 can continue to protect you and your family while slowing the spread of the coronavirus. These includes social and physical distancing, hand washing, wearing a face mask, safe grocery shopping and food handling, and practice mindfulness and stress relief.
Good day. I am Erin Claire Calio and today I will be discussing about the COVID-19 response of World Health Organization and Philippine governments. The World Health Organization. The World Health Organization was established on 7th of April 1948. This serves as the directing and coordinating authority in global public health within the United Nations system. Working at three levels in the organization: global, regional, and country, more than 7,000 whose staff worldwide collaborated with the governments of 194 member states and other partners to achieve the WHO founding vision of the attainment of the highest possible level of health by all people. In the Philippines, WHO has been working with the Department of Health and other national stakeholders and partners to increase its preparedness to address COVID-19, including the possibility of wider transmission. They provide technical support and essential supplies, strengthen laboratory capacities, sharing technical expertise, and communicating the risk. With the leadership of the Department of Health, WHO is supporting them on planning and messaging to communicate the risk and engage the public on COVID 19. A variety of materials has been released, including advice for the public on protective measures and the proper use of masks. WHO has also been at the side of DOH in briefing the media on the latest updates and technical advice on COVID 19 in the Philippines. The Department of Health also is the principal health agency in the Philippines. It is responsible for ensuring access to basic public health services to all Filipinos through the provision of quality health care and regulation of providers of health goods and services. The primary function of this department is the promotion, protection, preservation, or restoration of the health of the people through the provision and delivery of health services and through the regulation and encouragement of providers of health goods and services. The Department of Health has responsibility for the leadership, management, and coordination of these two response and recovery roles, coordinate and control the mobilization of all health responses to emergencies when emergency or counter disaster arrangements are activated. This includes hospitals. The Interagency Task Force on Emerging Infectious Diseases, or simply the ITF. This is a task force organized by the executive of the Philippine government to respond to affairs concerning emerging infectious diseases in the Philippines. The Interagency Task Force on Emerging Infectious Diseases was convened in January 2020 to address the growing viral outbreak in Wuhan, China. They made a resolution to manage the spreading of the new virus, which was known at the time as 2019 novel coronavirus, and eventually renamed to Severe Acute Respiratory Syndrome Coronavirus 2, the virus that causes coronavirus disease 2019. On March 9, 2020, President Duterte called the ITF EID amidst the rising cases of COVID 19 in the Philippines.
Next is the LGU or Local Government Unit, Iligan City. So in response to the COVID-19, the city of Iligan undergoes community quarantine guidelines, implementation of adjusted curfew hours and emergency response, observance of social distancing in public, and tightening of checkpoints and highway patrols. Updates of Iligan's COVID report and action is being monitored by the frontline services, including the City Mayor's Office, Emergency Operations Center, Health Office, Iligan City Fire Station, Iligan City Police Station, LGU departments, and etc. So, the local government unit of Iligan is scaling up the testing capacity and building more healthcare facilities for the city to be downgraded from its past modified enhanced community quarantine last September 2020. The quarantine status of Iligan City is currently at GCQ state or General Community Quarantine. Along with its COVID task forces and departments, the LGU Iligan maintains community check and public health protocols at full capacity with the continued support of the national government.
And now we are down to the last discussion, the conclusion. Philippines, as one of the countries massively affected by this pandemic, has to reach global solutions that needs to be in front of all majoring projects to comply. The world is at stake, and there's no assurance when we are recovering fully from these trying times. IATF, LGUs, and the rest of Philippine agency are at boundless efforts to fight and serve its countrymen amidst the pandemic. Hence, we will need to work towards eliminating problems such as social and economic disparities caused by globalization. Fail to do so, and we might see countries turning increasingly inward with the mindset of narrow minded nationalism. There you go, the impact of political globalization. We hope that you have learned a lot from our discussion, and please be reminded to hashtag stay safe. Again, thank you and good afternoon.